Hey, how's it going? Thomas here, trainer. I've been training at Show Up Fitness as an independent contractor for about 5 years now. Went through NPTI and they helped me pass the NASM certification. And then hooked up with Chris through his internship. I was one of his first, second generation group. They had groups of people. Um, yeah, and I'm still training to this day, getting better, feeling pretty good about that. And I think I have a little bit of information that I can offer that will help add value. So let's get started with screen sharing here. Okay, so how to provide excellent service and client results. So the first thing I did when I was beginning this whole process was I thought about, you know, what do I expect from a service that I'm paying $100 an hour for, or whatever price that I want to charge, right? And $100 an hour for me felt good. You know, more is cool, less it's fine, but I feel good about $100 an hour, and I've kind of had my eye on that number for a little while, and I want to pack as much value into that as possible, so that when they leave, they don't feel like they don't even second guess how much you know my time is worth. So, and for me to build up my skills, my coaching ability, and the knowledge and experience, I paid very close attention to all those things to make sure that anybody willing to pay me, I was able to provide a service and whatever results that they wanted. And yeah, let's see what we got next on this slide here. So, in any scientific situation, you want to be able to observe first, right? You can have all your hypotheticals and your theories and your experiments, but you got to be able to look first. You can't just jump right in without knowing anything about what's happening. And assumptions are dangerous. So try not to assume anything about any single person, because looks can be deceiving. Somebody can look unhealthy, but be very conditioned. It depends on how people are training and how they're eating. They might not look the way they want to look, but it doesn't mean they can't move. And then vice versa, some people look like they can do a lot, but they're actually quite weak. I've had people run through some circuits, 2 sets in, and they're shivering and shaking. So their glycogen levels are drained, and they need a little bit of help, and they need longer breaks and stuff, but they're trying to keep up with the herd. And so sometimes they can burn themselves out, and you have to think about medical conditions and past injuries and all this stuff. So it's very important to observe and find out what's happening, right? So you're going to realize, if you haven't been training, live sessions are unpredictable most of the time. And in the beginning, there was a lot of flakes, like people just wouldn't show up. So you'd be super ready, and nothing would happen. Although in another case too, someone might put you right on the spot, and you got to be showtime ready, perfect, ready to go with everything you got. And maybe even just have to look up some references and get some help, because you might just be challenged too much. It does happen where people come in really advanced, and you have to maybe in the second session have exactly what they want. So through the internship and experience, you realize that certain moves are easier to teach, like a chest supported row. Man, it's just like a sit, grab, and go. Farmer's carries, straight up, just grab these weights and walk around. Bird dog's pretty straightforward. Side planks, bridging. Um, most moves are pretty easy to, the ones that are easy to teach, you're going to want to use those, because in the beginning, you kind of just want to get to work, right? And then sometimes certain moves are a little more technical. Some things look simple, like the hinge and the deadlift. They look simple, but in reality, sometimes it can take a lot of effort to coordinate somebody's neurological firing. Because if you think about it, like the nerves, they're not mechanical. Nerves, they look like tree branches. They look like lightning bolts that travel through your body, and they wiggle around. Sometimes it's kind of like an octopus. So some people, even though they're in a human body, they move around like octopus or like a baby giraffe, and you have to reprogram everything. Um, and you have to be really patient with some of those cases. Um, so we, it's really useful to connect with like physical therapists and dietitians, registered dietitians who work on that medical level, because that's a perfect foundation to build off of. They're working with very sensitive bodies and situations, and it's like, if we can tune into what they're doing there, like how can we progress from there? And that's where we come in. We're trainers, we're not physical therapists, we're not diagnosing, or we're not doing any of that stuff, we're not prescribing or anything like that, but it is useful information to know what they're doing, because if you practice what physical therapists are doing, you can progressively overload those things. And then you realize, when you progressively overload over medically sound physical therapy exercises, you find that it's very fortifying, very safe. Tendons, ligaments, tissues, movement, activation, all these things are involved on that small level. And if you scale that up, and I mean, that's the formula to success is scalability, right? So you start on that level, and then you build your way up. And the same with dietitians. You want to look at their recommended macros. You want to look at recommended just nutritional information, and you want to pass along information that you heard verbatim most of the time. Try not to make assumptions based on information you take in. Just relay word for word what you've been hearing, and always mention that, like, we're not dietitians. If you are, then you are, but I'm not. So all I can really do is be like, okay, this is the suggested percentage of macros, and I can help you, and I can show you how to calculate that if you want. But I can't do meal plans, and you can't prescribe supplements or anything like that. You can give them a range, and I think giving ranges is the best thing to do right there. And then let's see. You'll see that some trainers and physical therapists, they'll use like a massage table to test range of motion, thoracic range of motion, outlet syndrome, like all these fancy words that get people interested, because it's like, oh, your posture is not so great, your hip flexors are pretty tight. There are pot of gold exercises. That's a line used by Pat Davidson. He says there's just some exercises that are like pots of gold, where if you do these exercises, they happen to show results on a tabletop and in performance. So then you can kind of lump a few things all into one basket if you do it properly. So for Pat Davidson, one of his pot of gold moves is like the Zercher Bulgarian split squat, or like a split squat with both Zercher style hold, where you put the weight in the crux of your elbow. And he goes in depth as to why that's such a special move, because he realizes when you go into the split stance, if you keep your pelvis level and even, one leg is behind you, you're moving in a unilateral space. And in a Zercher position, your arms are proximal to your body, nice and close to your body, as opposed to like a back squat where your arms are here, your shoulders in external rotation, horizontal, abduction. You're putting yourself into more of like an open position, and when Zercher here, you're more closed, you're more proximal, you're tight. You can work on your breathing mechanics a little bit better. And then once you go through that move and you can overload it, I mean, you can find results on a tabletop. You might find that IR, internal rotation, is better. You're seeing improvements there, instead of laying somebody on a table, working on their IR, releasing muscles and stretching, and then that's all you get. Why not get the exercise in at the same time, right? Moving forward, it's good to really find exercises that suit the body that you're working on. There's the person that you're working with and the body that you're working on. There's a little bit of a separation there, and usually when you call that out, people tend to wake up a little bit. Like, yeah, you have to connect to your body, which does amazing things, but you haven't been engaging with it. And I think that's where most of our value comes in, is that we realize the fancy equipment and all the really expensive stuff is not necessary, because you realize that the human body, biologically speaking, is a fascinating tool in itself. So, that's why I've been recently exploring a lot of body weight calisthenics exercises on top of like resistance training with weights and stuff, because you realize, like, if you position your body properly and you put it in a compromising, pose or statue. Some movements are very challenging with no movement at all. Just working with gravity, and gravity is huge. um let's see. And let's like most of the time when I'm working with a client, they're going through their own experience as I'm focusing on what needs to happen for them to make that, so it's kind of like a conductor versus the instrument player, right? The instrument player is focused on playing the notes at the right time, and in the right pitch and all that stuff, finely tuned. And then as a conductor, you have to make sure that during some parts of the song, it must sound strong, must be strong here, must be weaker here, more refocused here, balance, control here, speed over there, maybe a little bit of an isometric hold, make sure you're breathing. You're watching in live time. You're a third person perspective for them. You add value by adding perspective that they can't see. When you record yourself exercising, you look at yourself and you review your movement, and that's when you can clean it up. Now, as a trainer, you become a live version of that, like right then and there. So they don't have to do a review process. They can fix it on the spot. And I think that's one of the biggest value points of being a trainer, and just being there for them, for sure. That helps, and of course you got to spot them if they ever lose it. So you gotta have failure protocols too. So let's move on. Tips and tricks. Let's move my head over here. Following what professionals is like the best thing to do in the beginning, because there's people who have been in here for like 20 years, and if they're in there for 20 years, they know a trick or two. They know some information that keeps them going, keeps them engaged. So, people like Eric Cressy, Chris Beardsley, Prehab guys, Brett Contreras, Sohi, and then even some popular influencers who have like a buttload of followers. I mean, there's something to learn from everybody. So definitely take a look at people and see what they're talking about. And you'll realize the people who are really legit with the science, they have like an ongoing message that just keeps on going. And it's going to go for the rest of their lives, because currently speaking, the fitness industry and the consumer are at a bit of a disconnect. It's almost like magic, right? Where the magician knows how the trick works, and then the audience is like wowed by the tricks and stuff like that. But if you're going to be super legit and scientific, you're going to have to break some stigmas and some stereotypes that come with it. So sometimes we have a lot of work to help people unlearn some bad things that they might have learned in the past, right? Hold on, let me go back. Sorry. Listening and trying to understand who your client is. Who's in front of you? How old are they? How much are they sleeping? How much are they eating? What are they eating currently? Do they know? How much do they care? And then how much, how in depth are we really going to get here? Because some clients, they want every single detail. They want to know all the technical details. They want all the data. And some of them just want a simple plan, right? So it really depends. It helps to educate as much as you can, but some people just don't have the time. So you just have to give it to them straight, whatever they can, keep it simple, Don't assume good form means pain-free or anything like that. It's always good to ask how the person's feeling, because, without checking in, you can't assume anything like that. So make sure, like when you're doing an exercise, you ask them, how's that feel? Do you feel the muscle in the right place? And sometimes that's not necessary. Like you don't need to feel the muscle in the right place, but then it's like, do you feel, does it feel unnatural? Do you feel any pain? And like, they have to confirm these certain things, to make sure that it's healthy, right? They want to, it should just feel comfortable. And a lot of my value that shows up the most is, these like micro adjustments I'll make. I'll be doing like a kneeling landmine press, and some people they can use an Eric's pad, some people like a yoga block, and you can test things out and never get too sick of that, because those little things, they really pay off when it comes to the service per time. You'd like, this move hurts my wrists. Okay, let's try this adjustment. Let's adjust the rotation of the wrist. So let's try putting dumbbells on the floor. Let's try these gymnastic wrist wraps that I bought for $10 on eBay, and then I'm going to keep trying and trying until this move, though tiring, is comfortable, right? Those little micro adjustments make a big difference when it comes to value. Being patient and present, like really trying to be present with the person and how they're feeling at the time, and then being patient with like their results, their misunderstandings about the science or whatever it may be. And sometimes what you got to do is just kind of let them ride that wave, and you play that game with them as you slowly start to introduce the concepts that are really going to make change for them. Sometimes that does seem to be the last resort. And being as prepared as possible. What I mean by that is sometimes when they don't show up, what are you going to do? You know, are you prepared to just waste an hour in a productive way? You know, because sometimes it comes out of nowhere. What are you going to do with it, with time that just came out of nowhere? Are you going to work out? That's usually the first idea right there. Reading, have an audiobook ready to go, have your notepads ready to go, maybe have your camera equipment ready to go, and have some content ready to get shot. You know, you can always do something, especially if something falls through. And sometimes in this industry, you realize that happens a lot. But that's okay, because like when you can adapt to those things and then not complain or not, you know, get so pent up on making sure that every single thing is in its right place, you'll be much better if you just kind of let it flow. Because like sometimes people last minute cancel and just like, okay, that's how it goes, you know. Some people are pretty good at being aggressive and asking for that money though. So I mean, if you got that in you, go for it. Using tools. So personally, I use a pitch counter. This goes all the way up to 9,999, and I'll reset it usually per set. And then while I'm watching somebody, I will be counting reps. Counting reps is not the most important thing. That's why I'm putting it into this device, right? And I'm going to be watching you while you do your movement. And if I see clean, really qualified reps, you get a click. Boom, boom, boom. Sometimes you can use this to activate the type 2X muscle fibers. So let's say we're going to do like a vertical jump, and you don't jump till you hear the click, jump, right? Jump, like that. So you can use it in many different ways. And then you can do set records, total volume. There's only so many things. And then, you know, keeping track of all that, taking notes. I also use timers between sets. So after an exercise, let's say like it's an 8-rep max and I want maximum performance. We're not thinking about gains, muscular gains or anything like that. We just want the same amount of reps. So if you hit an 8-rep max, there's studies that showing if you rest for 8 minutes, you'll most likely get very close, if not 8 reps again, right? So for 8 minutes, we can't do anything. So I use stopwatches, I use timers on my phone. Sometimes I'll say, hey, Alexa, set a timer for 8 minutes. Sometimes I'll do something like that. And Alexa, cancel timer. I don't want that timer. So little tools like that. Notepads, I use a notepad.
To turn off notifications, go to the settings.
Alexa,
app
stop.
and click notifications.
Stop. Sorry about that. That was very silly. All right, so let's talk about my clients. Some of them, they go all over the place, right? So I have a 63-year-old woman, 160 injured knees. So she's going into a knee replacement surgery, and she wanted me to help her. Needed to condition her body to prepare for recovery. Played tennis all her life. So she loved tennis. She loved tennis so much she would bring a selfie stick and hold it, and we would like put it up, prop it up somewhere while she watched games, and she would work out during the time. You know, sometimes we could dive deep into mechanics. Like I mean, I did get to the point where I asked her how she was serving, and I realized like the way she was serving, she was landing, she was jumping, landing, you know, and torquing her knee medially. So she was doing that basically all her life, and nobody caught it, you know. And sometimes that happens. Like if I caught it 25 years before and I met her, I would have fixed it by then. But if just imagine bad form, 25 years, medial torque on the knee over and over and over and over again. She's wearing down everything in the structure of the knee area. You know, she's just too far gone. And then she gets to this point. So we work with what we got. You know, you can't go back, right? So you just got to work with what is presented to you. So, you know, we would hit upper body, lower body, all sorts of things. And the first day she came in, she pulled her back. So she was already hesitant to come in because she hurt her back. She pinched her back. Getting up and down was painful, right? And with her specifically, I wanted to teach her the hinge pattern. And the hinge pattern is very hip dominant, and basically she couldn't bend over because she was hurting her back. So she would start with her back, her spine. Oh, she couldn't move. Oh, she couldn't move. And then I showed her on the first day to pull her hips back. And because she didn't have depth, I had her touching things that were just a few inches. So I'd have her hinge just a few inches, squeeze her glutes. How'd that feel? Feels good. Okay, let's go a little bit lower. I found a lower bench. I'd have her touch the top of that lower bench. She would hinge just a little bit. How about pain there? Any pain there? She's like, nope. And then eventually, on that first day, I got her hinging all the way down to a 15-pound kettlebell on the floor. So the range of motion just basically increased huge, showing value in the first day. After about 6 months of training with me, she lost a lot of body fat. Her masseuse was saying that I was a miracle worker. It's pretty nice to hear that. And yeah, and then after surgery, she was able to recover really well. And then that was it. That's pretty much the success story there. I'm currently working with this 63-year-old man. He came in at 193. He's currently at 177. He tore his calf muscle when he stepped into this ditch, and it kind of twisted his leg. It was bad. You can see the scar tissue on his leg. It's not good. He's very much into jiu-jitsu. He's been doing that for 15 years. Golf, I'm not sure how long he's been doing that for, but he does that now. He goes to golf courses, and he played hockey back in college. He went to Canada. He did tours. He was like a legit super duper hockey player. And when he first came in, his range of motion was pretty garbage. So I learned a lot from the physical therapist. They showed me how to regress as down to a feather. You know, I had him holding on to the TRX. I had him squatting down probably halfway. And then at this point now, though, he's squatting to 90 degrees, which is like, it seems to be the bare minimum for some people. So he's getting down to 90 degrees and he's squatting pretty good. I mean, I think he's put up at least 145 pounds for 12 reps, something like that. And he's doing single leg step ups now. He can do curtsy lunges with no pain. He does hip thrusts. His hip thrusts are actually really strong. It's very impressive. And let's see, yeah, so he's 177 now. His body fat percentage went down by like 5%. And he's very interested in starting a third package with me soon. And his focus next is power. And he's ready for that because he's been through 2 programs and his tissues and conditioning are up there. Next is probably my best athlete so far. 26-year-old guy, 6'2", 190. Likes golf, basketball, football, ran a marathon a few years ago. And when I first started working with him, he had knee pain and low back pain when squatting. You figure out that most moves that have problems like back pain, knee pain, and stuff like that, they usually have like an order of operations, which, you know, helps solve the problem. And for me, I found that bracing the core, taking a big deep breath into your belly and bearing down on that helps stabilize the back and the knee. So both situations went away when I taught him how to breathe into his stomach, bear down on that, hold his breath as he controlled and balanced the descent, and it exploded on the way up. And also you realize that transverse abdominis is the stabilizer for the legs, right? The sits muscles are the stabilizers for the shoulders. So you got 4 there, but then transverse abdominis, you know, you got to get your people feeling their core for their legs to be more stable. And now he's a beast. He's all over the place doing everything. Vertical jump, horizontal, broad jumps, sprinting, uphill, downhill, flat. We're doing everything, you know, bilateral, unilateral, bench press, weighted push-ups. I mean, this kid can do basically everything. And then we did the half-mile challenge on the assault bike. He got 51 seconds, half mile. Man, it's pretty good. Anything under 55 is pro athlete. Next, 22-year-old, 5'2", 160, never worked out a day in his life. He's a super couch potato. And he tells me he can work out once a week for 30 minutes. All right. You got to be pretty sharp and ready to know exactly what to give this person because he's not giving you much time, you know. And so you gotta just get them in there, just get the whole body lit up in the safest way possible. And the first probably 3 months, every session he left nauseous because his body was just not ready for any sort of movement. And he just had to get used to that. And I just had to keep being with him and making sure the movement was proper, because the movement wasn't all there yet, but he was a quick learner. And at some point, I didn't really have to pay attention too much on his technique anymore, and we were able to get to work. And for him personally, as a client, he cares about the numbers. Some people care about their records and some people don't, but he's like literally motivated by them. He said he wouldn't come in if I didn't take notes. So it really depends on what your client needs. Make sure you pay attention to things like that. Next, we got a 31-year-old, 5'6", 150 pounds. He's done Orange Theory many times per week. He's been doing that for about 4 years. Now, he says it's too repetitive and his gains have plateaued, and he had no experience with weightlifting. And Orange Theory, they really don't do any sort of progressive overload, and that's where we can come in. Orange Theory and all these other places, they might have fancy equipment and fancy programming and really cool marketing, like nice looking models and motivating videos and all that stuff. But in the end, if we're not paying attention, Alexa, stop. If we're not paying attention to them and who they are and what they can do currently, and we can't build off of that, then it doesn't really matter. We have to connect to the person that we're trying to help, that specific person. You got to get surgical with it. Make sure you're looking at that specific person that you're trying to work with and help them with where they're at and building them up, regardless of what, who they are. And if you're not ready or qualified, look for references. Look for people that can help you. I have been in scenarios where I'm like, I don't know what to do with you. I'm going to hand you off, because our scope of practice is limited, and as you get more experience, sometimes, you'll be able to handle those situations better, especially if once you reference those people out, you shadow the session. So once in a while, I'll send somebody out to a physical therapist, and I'll shadow the session to see what the physical therapist does. And most of the time, they ask just a bunch of questions. They want to know. So information is very important. Last but not least, we got our 18-year-old spry young man, 6'1", 175 pounds, loves mixed martial arts, basketball, boxing, and tennis. And he's hard. He's got ADD. He likes to play. He doesn't like to train. And once in a while, you want to get on this strict program that works, and you want to be super professional, and the kid is just not into it. He's so young, he just wants to have fun. And he might think you're really cool or whatever. He just wants to get to know you or something like that, or talk about movies or games or something. And you can fit that in, but try your best to get the work done. Try to get as much work as you can out of that person, because most of the time, some of these clients, they're going to just enjoy being in your company. And that's flattering, but you definitely want to have some work done. That tends to happen. All right, moving on. Let's think about the nervous system. Make sure you're thinking about how those neurons are firing, and the movement is sharp based on this system in the body. This whole system right here controls everything, right? So nerves control muscle, muscle control bone, and you want to definitely tap into this information. Look into it. Easter eggs. This is the definition of an Easter egg: an unexpected or undocumented feature in a piece of computer software on a DVD included as a joke or a bonus. Kind of like the pot of gold exercises, the Easter eggs of the fitness industry are, just fun things that, the challenges that might really benefit somebody, or just something funny to keep it lighthearted. I kind of actually forgot why I mentioned this, but if you can keep an eye out and you're very, explorative, you can definitely discover some things in the industry that will just feel like a bonus. And then it's not monetary, there's like a rewarding feeling or something that just makes it funny. And that's super, super important to keep your head in the game, because there are definitely some special things out in the universe waiting to release themselves and be discovered And it's basically like the magic of anything, of reality, right? This picture is just kind of as a reference, as just tuning in to what your client wants to do, and make sure that whatever they want, you're trying to program around that, right? Make sure you're listening to your client. All right, that's pretty much all I got for today on this presentation. I think my next presentation will be talking about specifically what will happen during a session and what questions you should be asking. All right, cool. Thank you for joining me. If you have any questions, feel free to message me. My Instagram was back there if you wanted to take a look at it again. Actually, it's at the bottom, right under thank you. Instagram, Thomas Velocity. Yeah, feel free to follow me. Feel free to DM me or lurk, whatever you want to do, because most of the time people are just lurking, and that's fine, because sometimes people who lurk, they just want to take in what you have to share, and that's cool with me. All right, thank you, take care.